So again, good morning or good afternoon to you guys, and welcome to today's webinar, Empower Health Center Staff to Raise Awareness About Maternal Health Warning Signs, Tap into the CDC Hear Her Campaign. My name is Elizabeth Breitenbach. I'm a meeting and event specialist based in our clinical affairs department here at NAC, and I'm pleased to bring you this event along with my division colleague, Wanda. Before we get started, I would like to review a few housekeeping announcements. First things first, this event is being recorded and will be available for later for an on-demand recording. You joining this event automatically consents you to this recording. If for some odd reason you do not feel comfortable, please exit the Zoom event. Again, this event is being recorded for the duration of today. Audio connections, you either physically called in or use computer audio. Either option is completely fine, though we do recommend that if you're in an area where Wi-Fi can sometimes be a little bit spotty, physically calling in ensures you to hear all of the content. Just a little heads up for our participants out there, your audio and your video has been disabled. This is really just to avoid any sort of background noise interference. Q&A box, I want to thank the folks that have submitted questions in advance. We truly appreciate that, and we do have it for you guys for our Q&A session later on today. But throughout today's webinar, if you have any questions for our fantastic panelists here, feel free to use that Q&A box. Simply type your comments, questions, or concerns into this box. You can actually submit questions anonymously if you want to, and there is also a feature where you can upvote a question if you feel that somebody has asked a question that you want to prioritize during today's session. Friendly reminders, today's event is being recorded. All audio and video have been disabled. We encourage you to submit your questions and answers into that Q&A box. And then we do have a few polls for you today to answer as well, so keeping that in mind. With that being said, I'm going to turn things over to our fantastic moderator, my colleague, Wanda. Wanda, feel free to take it away.
Sure. So welcome, everyone. And my name is Dr. Wanda Montalvo. I'm the Director of Evidence-Based and Integration Strategies at the National Association of Community Health Centers. And I want to thank my colleagues for joining us today. I'll let them introduce themselves, but wanted to kind of level set the work that NAC has been doing in this space. We've been working with CDC on contraceptive care, postpartum, looking at how we can have linkages and relationship and partnerships built between maternal mortality review and perinatal quality collaboratives at the state level. And I want to thank all the health centers to date that have participated in these projects. And I first kind of came to meet Brittany at the Maria meeting last year and see her and a panel present on this, and basically like attacked her at the meeting along with Dr. Hollier and said, we have to do this topic again for health centers. Once we get through, you'll see why, but I think predominantly part of my work has required me to go out and visit health centers in different parts of the country, look at the work that they're doing around prenatal and postpartum care. And one of the things that really stood out for me is the need of being able to communicate and raise awareness in our community and our patient population and our clinicians of this particular topic of Hear Her and all the materials that they have and embedded in science and research to help raise awareness. It's in multiple languages, and I just think that we don't have the bandwidth to invent new tools, but we have the bandwidth to leverage the resources that are available to us. So at this point, I'm going to allow my colleagues to introduce themselves and then get rocking and rolling on our presentation today. Thank you for joining us.
Well, thank you so much for that introduction, and I'm so excited to be here. Thank you, Dr. Montalvo. Thank you, Elizabeth. So we are so excited to talk to you today. I am Brittany Behm. I am a health communications specialist in CDC's Division of Reproductive Health. Been here several years, have been really working hard on the Hear Her campaign. And I will turn it over to Dr. Hollier in just a couple minutes to talk to you. But I just wanted to set the stage. We at CDC have been really working to prevent pregnancy-related deaths and eliminate health disparities for some time. And so this campaign launched in August of 2020 to really just complement the work that CDC, other government agencies and organizations all around the country are doing to address the high maternal mortality rates in the US. But before we get started, I really just want to make sure everyone's awake. We're going to do a quick poll. Before this presentation, have you heard about the the Hear Her campaign? So we can go ahead and get started on that. So the answers are going to be either yes, you have heard about it and are using its resources. Yes, you've maybe heard of it, but not quite using the resources yet. And maybe no, you've not heard of it. And any answer is fine. We're going to give everyone a few seconds to let us know if you have heard about Hear Her before today. All right, we're seeing good participation. Maybe just a little bit more time. Have you heard about Hear Her before you heard about this webinar? All right, Elizabeth, I think we're probably hitting our amount. We can share the results. So it looks like most of you guys, 63%, have not heard about the Hear Her campaign, which is fine. And that's why we're here today. So I'm excited to share
That's
about
the
it.
opportunity for improvement. I'm so excited.
Great. All right, so we'll move on. So I am going to turn it over to Dr. Lisa Hollier. She's going to talk a little bit about the national data around pregnancy-related mortality, kind of set the stage about why this campaign is so important. So thanks so much, Lisa.
Thank you so much, Brittany, and thank you, Wanda, again for having us here today. I'm the Senior Medical Advisor on the Maternal Mortality Prevention Team in the Division of Reproductive Health. I received my doctorate in medicine and master's in public health from Tulane University, completed a residency in OB-GYN, and then a fellowship in maternal fetal medicine. I have the good fortune of being a past president of the American College of Obstetricians and Gynecologists. I am still seeing patients every Monday at a large federally qualified health center in Southwest Houston. So again, I am especially pleased to be with you this afternoon. First, I'd like to share with you the latest national data from our Pregnancy Mortality Surveillance System, or PMSS for short. This surveillance system provides data on deaths that occur during pregnancy or within a year of the end of pregnancy from any cause related to or aggravated by the pregnancy, known as pregnancy-related deaths. PMSS has national participation and consistent information available over time. I would like to take a moment to acknowledge, as I present these numbers, that there are lives lost behind these data, and each number represents a tragic loss to a family and a community. Next slide. The pregnancy-related mortality ratio is the number of pregnancy-related deaths for every 100,000 live births. This graph presents the pregnancy-related mortality ratio from PMSS data from 2000 to 2019. Pregnancy-related mortality is not improving. Some of the increases that we see may be due to changes in data collection. Next slide. Considerable racial ethnic disparities in pregnancy-related mortality exist. Non-Hispanic, Native Hawaiian, and other Pacific Islanders, Black, American Indian, and Alaska Native people have the highest rates of pregnancy-related deaths. 2019 was the first year that CDC released information for Native Hawaiian and other Pacific Islander persons as a separate race category to improve the documentation of the disparities that need to be addressed. Next slide. The pregnancy-related mortality ratio is also higher in rural areas than in urban areas. Next slide. Next, I want to share information from another source. Maternal Mortality Review Committees, or MMRCs, are multidisciplinary committees that seek to provide a deeper understanding of maternal mortality through understanding both the medical and non-medical contributors to deaths, and developing and prioritizing recommendations that may reduce future deaths. MMRCs use medical records, social service records, mental health records, autopsies, and in some cases, informant interviews to better understand the circumstances of a death. Because of access to broad data sources and expertise, MMRCs can increase our understanding of both the medical and non-medical contributors to deaths and specific prevention opportunities. For your awareness, CDC funds MMRCs in 44 states and 2 U.S. territories for the Enhancing Reviews and Surveillance to Eliminate Maternal Mortality program. In September of 2022, CDC released data on pregnancy-related deaths from the Maternal Mortality Review Committees in 36 states from 2017 to 2019. Because MMRC data is more comprehensive, we are able to get additional details about the timing of when these deaths occur in relation to pregnancy. So we're going to do a quick polling question. Liz, will you go ahead and advance the slide to the poll? All right. What percentage of pregnancy-related deaths occur between 1 week to 1 year after the pregnancy? Excellent. We've got a lot of responses coming in. Wonderful. Keep those answers coming. All right, Liz, it looks like we've got just about everyone. Okay, you can close that and show us the results.
The results are up.
Oh, sorry. Thank
No, you're
you.
fine.
Perfect. All right, so it looks like 30% and 53% were really neck and neck there. So we're going to go on to the next slide. In terms of the timing of death in relation to pregnancy, data shows that 22% of the deaths occurred during pregnancy, 25% during delivery or in the week after, and strikingly, 53% occurred in the postpartum period, when people are often not having frequent visits with their healthcare provider. So all of you who chose 53%, you are correct. Many people don't realize that complications can still happen up to a year after the end of pregnancy, but this is especially important for us in health clinics who may be serving postpartum women. Next slide. Data from these committees reveal that mental health conditions, hemorrhage or excessive bleeding, cardiac and coronary conditions, infection, thrombotic embolism, and cardiomyopathy accounted for over 75% of pregnancy-related deaths. Mental health conditions include deaths due to suicide, unintentional or unknown intent overdose or poisoning related to substance use disorder, and other deaths determined by the MMRC to be related to a mental health condition, including substance use disorder. It's important to note that the leading causes vary by race and ethnicity. For instance, mental health conditions is the leading cause of death for Hispanic people and non-Hispanic white people. Cardiac and coronary conditions and cardiomyopathy are the leading cause of death for non-Hispanic Black people. We are not going to decrease maternal mortality in the U.S. in any meaningful way without prioritizing interventions that address the leading cause of death to those who are disproportionately affected. We've got another polling question for you, Liz. All right, what percentage of pregnancy-related deaths do you think are preventable? Wonderful. Lots of answers in.
I realize there might be a hint if you looked at the invitation for this webinar, you might have the answer.
Exactly. All right. I think we've got all of our answers in. The majority believed about 80% are preventable. Awesome. Liz, can we go? Thank you so much. MMRCs determined that with one or more reasonable changes to patient and family, provider, facility, system, and community factors, 84% of pregnancy-related deaths had at least some chance of being prevented. Next slide. There are, of course, many factors that contribute to maternal mortality. According to data from an earlier report, MMRCs identified factors at the patient, family, provider, facility, systems, and community levels. At the patient family level, a lack of knowledge of warning signs or need to seek care can be a factor. Healthcare provider level factors include missed or delayed diagnosis, inappropriate or delayed treatment, and a lack of continuity of care. In 2018, our division leadership and communication staff decided that a communication campaign could potentially start to address some of the factors at the patient and provider level. I'm pleased to turn it over to my colleague, Brittany Behm, to talk more about the campaign, and then I'll jump in again at the end to share some examples of how I use its resources at the FQHC where I work. Brittany, over to you.
Yeah, thank you so much, Dr. Hollier. I appreciate it. So I want to talk a bit about the campaign. The Hear Her campaign was developed to really raise awareness of urgent maternal warning signs that can happen during pregnancy or in that year after pregnancy, and then really encourage support systems to listen and react. And we want healthcare professionals to also be listening to pregnant and postpartum people's concerns when they express them. So our priority audiences are pregnant and postpartum women, all those who love them, their partners, family, friends, doulas, community health workers, healthcare professionals who serve these people, which may be obstetric providers, but also pediatrics, other fields like emergency medicine, urgent care, primary care, you name it. And given the disparities that Black, American Indian, and Alaska Native communities face, we do focus efforts on reaching those communities. Next slide. So some of the key grounding principles of the campaign are that pregnant and postpartum people really know their bodies, and they often know when something is not right. Listening and taking those concerns seriously is simple yet really powerful in order to prevent some of these deaths. We know that timely treatment, quality care can also play a big factor in preventing deaths, and healthcare providers really need to be listening and responding appropriately to any health concern that is raised. So partners, friends, family, we're all important advocates. So pregnant and postpartum people are not on their own, but they have people to advocate for them and make sure they're heard. And really everyone has a role to play. Everyone on this call has a role to play in improving maternal health. Next slide. Women's stories are really central to this campaign. So the website features several compelling stories from women about their experiences during or after pregnancy. They share how their pregnancy-related complication or condition affected them and how they got help. And so I'd like to share, it's a 3-minute video. It's a compilation video that was created at the beginning of the campaign. So you get a feel for the tone and the messages we work to amplify. And I will share, sometimes it can be hard to hear. So please take time for yourself if this may be upsetting for you. But let's go ahead and play this 3-minute video.
Being a mother is amazing, and we have this story together. We both survived. And not everyone who faces what I faced gets to say that.
I had constant chest pains. It felt like someone was stabbing at my chest. It felt like I couldn't breathe for about a good 3 to 4 minutes, and it was painful.
I had heard of preeclampsia before, but I had never, experienced it due to the fact that my first pregnancy was so normal. So once I started having the symptoms, it was very, very scary.
I knew with this pregnancy something didn't feel right.
If you know in your gut that something is wrong, something is wrong.
I told my family members, and they were like, it's just pregnancy related. You know, everyone goes through it. I told my spouse what was going on. He was like, you're exaggerating.
And then when I would voice my concerns, sometimes it would be, oh, you're pregnant, your feet are supposed to swell, or, oh, you're fine, you're pregnant, like, it's fine, but I didn't feel fine.
I didn't have what I needed, the tools. I didn't know who to talk to or how to talk or how to speak up for myself. I was scared. I was scared a lot of the time because I just felt like no one heard me.
No one should have to feel that way at all.
I felt like I don't think that this is normal. I don't think that I should be feeling like this. So I went to a different hospital and they found an 11-centimeter abscess on my uterus. They'd never seen this before, and that they said that had I not come in, it could have easily been a there's nothing we could do situation. So even if those around you aren't listening, or they're trying to pacify what you're feeling and telling you this is just normal, trust your gut and know that it's not normal if you don't feel it's normal. And tests may come out, to say that it's perfectly fine, but you'd rather err on the safe side and know that you're okay.
It's extremely important to hear women because you don't know what they're feeling, but they do.
My advice to a woman is, you know yourself, you know your body. If it's nothing, then let the doctor tell you that it's nothing, because you'd rather be safe and it be nothing than have not spoken to anybody and it be something very serious and something that is preventable.
I just really want women and their support systems to advocate hard. It could mean your life, it could mean your child's life. There's no little questions when it comes to your health care.
I want to share my story to help other women speak up and be heard. Hear her.
So I really want to thank those women for their vulnerability and sharing their stories. Since we produced that, we've produced a series of additional videos featuring American Indian women who experienced complications, and we encourage you guys to check them out. Very powerful. Next slide. So in addition to the video testimonials, we have a number of print and digital resources. We continue to develop more over time. As I mentioned, we have also developed culturally appropriate resources with and for American Indian and Alaska Native communities. This slide gives you a snapshot of some of the key resources we have available, and I will chat through some of these individually and some ideas for how health centers could utilize them. And so please also note that we have printable resources available to order for free, and I'll talk about how to access those in a minute. Next slide. As Wanda had mentioned, we have materials available in a number of languages. We're really proud to be able to offer these in so many languages, which may be of interest to those who serve communities where English is not the primary language. Many of these translations have been done in response to requests from the community. So please let us know if there are additional translations that would be helpful for your community. We'd be happy to look over that. Next slide. So one of the most popular resources we have is this poster that highlights the urgent maternal warning signs that really require medical care immediately if someone who is pregnant or was pregnant in the last year experiences them. So they could indicate a serious pregnancy-related complication. And so there's 15, there's a lot, but there's icons on this poster that kind of helps people identify what the symptom is. There's more information on the website about the individual symptoms and what they could mean, what health condition it might indicate. And so these can often be used as a guide to talk through with pregnant or postpartum clients or community members. And we also have it available as a magnet size, which is really popular for people to put magnets on their fridge. So they might be shared at conferences or community events, maybe hung in OBGYN offices or exam rooms, maybe included in prenatal or postpartum toolkits. Next slide. We also, one of the goals of the campaign is really to equip expectant and new moms with information and tools they need to help talk to their healthcare providers about their concerns. We know it's a vulnerable time. They may need some tips in starting that conversation and what to say. So we have this conversation guide and smaller palm cards, both for pregnant and postpartum women, but also for their support systems. And they describe the urgent maternal warning signs. They describe tips for having conversations around concerns you may be having. So these guides could, of course, be shared with pregnant and postpartum clients and their families, handed out during community events, included in toolkits, or shared in newsletters. Next slide. We also have a lot of digital resources, so shareable graphics that could be posted on websites, used in blog posts, shared on social media. Some health departments have done paid media campaigns using these graphics locally. Next slide. As you all know in your work with community health centers, all healthcare professionals who interact at some point along the continuum with pregnant and postpartum patients have a role in ensuring women get the care they need and really just improving maternal health. And so we have materials that were designed specifically for obstetric professionals, but also pediatric professionals and other professionals. You know, as we all know, emergency care and urgent care are often on the front lines when someone has an emergency. So raising awareness about knowing if someone is pregnant, if they were pregnant, knowing their status, and getting help right away. So we have print materials, we have sample social media posts and shareable graphics, expert videos, and additional clinical tools and resources, including linking to patient safety bundles, linking to trainings on implicit bias, stigma, cultural awareness. So community health centers can share these materials with their staff. Materials could be handed out at conferences or events for healthcare professionals, could be hung on walls in office settings, whether it's OBGYNs or emergency department, primary care, or other offices. Next slide. We have several videos, including the Division of Reproductive Health Director, Dr. Wanda Barfield, and other wonderful experts who speak peer-to-peer to other healthcare professionals who may serve pregnant and postpartum people. Several of these focus on health disparities and addressing unconscious bias. Next slide. I'd like to share one video. It's of Dr. Laura Riley, who's an OBGYN and maternal fetal medicine specialist. And she describes just the importance of being intentional, listening, validating people's concerns. And it's just about 1 minute. So we'll play it now.
My name's Laura Riley. I've been a maternal fetal medicine specialist or high-risk obstetrician for about almost 30 years now. Many Black women will say to me is that I know when I go into the hospital that I'm gonna have to speak up more because people don't listen to Black people. And you gotta acknowledge it. It's true, and it happens all the time across the country. I think it's worth, saying I understand. I think it's important to validate what those concerns are, whatever they are. Pregnancy is anxiety provoking. And so it's important for people to understand it's okay to be nervous, but, bring your concerns forward and I will try and answer your questions so that you're not nervous and so that you can actually enjoy your pregnancy. I feel like you have to be intentional and listening and absorbing the information and then being able to feed it back to a patient is so incredibly critical to what we do that it's worth those extra minutes. Hear her, it could save a life.
So I thank Dr. Riley and all the experts who have taken time to share their perspective. I think it's really helpful. Next slide. So we have many additional clinical tools and resources. There are a lot of organizations who have great things out there that we just like to provide and share, including clinical toolkits, trainings, the A1 post-birth warning signs. There is a lot, and we really recommend everyone, read, review, share these articles with healthcare professionals in your network. You could include these where appropriate in trainings or presentations, really to any healthcare staff or other professionals who serve pregnant and postpartum people. Next slide. So this slide, really just turning toward ideas for using the campaign material. So we just want to kind of give some examples to get the brain flowing, the wheels turning on ways to use. So, we have pre-written articles that health centers could take and share through newsletters or blogs or with members of the local news media. You can post any of these Hear Her graphics on your organization's website, through social media, other digital platforms that link to more information. We have radio and broadcast public service announcements that can be downloaded and shared with local broadcast or radio stations. You could even play the PSA or some of those videos of personal stories at conferences or community events or other meetings where it makes sense to incorporate some personal stories. Next slide. You could also integrate some of these resources into perinatal education kits. You could integrate them into quality improvement initiatives or provider education. Any of these could be disseminated through meetings or presentations, exhibits, health fairs, other in-person or virtual events. And of course, using them to really counsel clients and community members using some of these handouts. So I'm sure you can think of additional ideas in your particular setting where you could share the resources, but really thinking about healthcare staff, patients, community members, and anyone who supports birthing people. Next slide. I do want to note this is the link, the CDC info on demand, that we have printed materials that are available to be shipped at no cost. We have 5x7 palm cards, 11x17 posters, and we encourage you to get on there and order what you need for your health center. And we're also working to have the magnets available to order too. So stay tuned for that. Next slide. And one example I did want to share is from a group called Strong Beginnings. It's a federally funded Healthy Starts project in Michigan, and they chose to use the Hear Her campaign to educate birthing people on the urgent maternal warning signs as part of their postpartum bundle. So they provided several trainings to hundreds of providers and home visitors in the use of Hear Her. They had their local hospital systems use Hear Her at obstetric intake, at hospital discharge, and postpartum visits. They also had cool education sessions for male partners, which included the Hear Her support system materials, and they shared through a monthly Manhood Monday Facebook Live, and they had these Fathering in 15 Fridays, and they have a Strong Fathers newsletter. So really encourage the support people to kind of rally around their loved ones. And the Michigan Department of Health and Human Services, sent links to all their home visiting programs statewide. And one of their lessons learned was that adopting Hear Her materials was efficient and readily accepted by community partners and clients. Next slide. So I'd like to invite Dr. Hollier to come back and share some tips about how she works to incorporate these resources into her work as she serves in clinic weekly at a federally qualified health center. So I think it'll be great to hear some of her ideas. Lisa.
Thanks, Brittany. I love all of the Hear Her campaign materials, and I want all of you to know that I used them even before I joined the CDC. I want to start with a suggestion. Before you implement any project, engage your clinic leadership. They may have structures in place to implement and support quality initiatives. After trying out the campaign materials in my patient population, the warning sign poster you can see here on this slide seemed to work best. You may find that different materials work best for you. In our setting, we have customized materials that we used at the first visit that include warning signs, so I used this later in pregnancy. When I first started to use the toolkit for counseling and the tool for counseling and as a takeaway, I decided to link it to the GBS screening visit so I would be sure to remember. I print the warning sign sheet in the appropriate language and go through it with my patients. We already ask about contractions, bleeding, leaking of fluid at every visit, but other warning signs might be less familiar. This is also a good time to remind them that some of these problems can and do happen after delivery. It does take a few extra minutes to review, to listen to their questions or their family's questions and respond, but I know it's worth it. I'm going to pause here to take a few questions if you all have a few questions for me.
We have tons of questions. Some very kind of high level. This is being recorded. The recording will be posted to our NAC YouTube channel so that you can use sections of this to help educate staff back in your organization, along with PDFs and all the links so you can share this. One of the questions that came up was how can we work with health centers in our state to help promote this information? There are state primary care associations that can help disseminate this information, as well as, you know, our NAC distribution as well. I would also say that I think, Brittany, you said something really important, and Lisa, which is, you know, this is a team sport, that everyone across the health, our team has a role in this. So don't think of this content being only in, you know, OB, but our pediatricians, our social workers, our behavioral health providers, all play a role, especially when you look at the information and the data was shared. Health centers are really in that space of making a real impactful difference in that postpartum period. A lot of these patients come back into our setting. We use a family approach. So that pediatric visit, you know, that postpartum follow-up, all are touch points to help. And I agree with what was shared is, you know, you need these visuals, put them in places where people will see it, use this content to educate your staff. And I would also pitch that maybe you should take time and try and present some of this information to your board at your health centers. They are representatives of the community and can also help disseminate and connect with other community partners to help raise awareness in your own backyard of these warning signs and how to educate women and the whole family around the things that they should be looking for. One of the questions that came up was early on, and it had to do with, sorry, let me find it. Is there a difference in symptoms of PRC among birthing patients to full term and NICU babies?
Do you know what that's referring to, Lisa? I'm not sure if I have the answer for that.
I am not sure either.
Yeah.
Maybe we can follow up offline on that
and answer that later. A simple question of where you were pregnant within the last year should be embedded in EHRs. I think that's something that most of us think about, and wondering if Dr. Hollier has any thoughts about how do you use that in your setting?
I agree that were you pregnant within the last year is one of those really important questions, especially in triage, as part of some of the work that CDC is doing with ACOG. We're developing some resources, and this question is contained within those resources.
A question that came in earlier was, before you CDC broke out Asian Pacific Islanders from the rest of the data, where was it embedded before, and how, and, you know, when did you start doing that?
2019 was the first year that we published data for Native Hawaiian and other Pacific Islander people. Previously, the Native Hawaiian individuals were grouped with Asian populations in the category Asian or Pacific Islander.
One of the questions is, do the materials include outreach and marketing to gender non-conforming and transgender birthing people?
Yeah, thanks for that question. We are really mindful that not everyone who is pregnant or postpartum considers themselves female. And so we do consciously try to use inclusive language around people who are pregnant or postpartum, loved ones, birthing people. There are situations where we're referring to data that is people who responded as women. When the stories are of women, we refer to them that way, but we are very mindful that we want to be as inclusive as possible using the right terminology. And I think we still have a ways to go in terms of including more visuals that include non-conforming and transgender people and more of the visuals. So we are still working on new materials, but very mindful of that. Thank you.
Lisa, this might be for you. How do you encourage patients to share their concerns, specifically in communities where there are stigmas around mental health, behavioral health specialists, maybe even those coming in that might be living with substance use disorders?
So speaking from my clinical experience, apart from my role at CDC, I sit down and I ask them. And I give them time and space. There are a number of different strategies, and Brittany, if you know some specific strategies, I welcome that, but I really think taking the time to ask and to listen and to ask specifically is something that I have found to be helpful in my personal clinical experience.
Yeah, I would just add, it's so important to consider, physical conditions, mental conditions when we're talking to pregnant postpartum people, to really ask how they're doing, and give them time and space to really share that. It can be really difficult. And I think, especially in the postpartum period, once baby is here, a lot of focus is on baby. And we just know mental health conditions are so prominent during that period. And so again, for all of us to kind of have a role in checking in on people as part of our community, but then also in the health center, really recognizing if someone was pregnant in the last year, how are they doing? Take time, maybe give examples, look through that warning sign document. There are symptoms such as having really negative thoughts about yourself or thoughts about harming yourself or your baby, extreme overwhelming fatigue. So I think there's some things we can prompt with to kind of facilitate that conversation.
Another question, how can adverse pregnancy complications not be forgotten for women who have experienced them? We know that pregnancy complications are linked to later to elevated risks of cardiovascular disease. So I think from a holistic, approach from postpartum to primary care, how do we kind of remain mindful of that?
Again, based on my clinical experience, apart from the work that I do for CDC, we do recognize that pregnancy complications like preeclampsia are associated with an increase in the risk of long-term cardiovascular disease. And it's important to have that discussion with patients so that they understand. There are some suggestions that are contained in clinical resources, such as those from the American College of Obstetricians and Gynecologists, that provide suggestions for what should be done in that care coordination, that transition from pregnancy to postpartum to long-term women's care. So there are some great resources that are available, and I would recommend taking a look at those resources.
I totally agree. And I think, why I love this relationship between NAC and CDC, as we know, and as I know, as someone who's worked in health centers, is that we don't have the time to invent new things, right? And a lot of the content that's been developed is visually appealing. It is culturally sensitive. It is, people in our community will see themselves in the messaging. And I would encourage health centers, if you have opportunities, to play some of the videos that are already developed by CDC, play them in your waiting areas, try and find opportunities to, speak on local radio, put it on your Facebook page, anywhere you can create the link and help promote this in your community will make a really big difference. I think that also look at your packets, go back and look at the prenatal packets you put together, look at what you provide in the postpartum period, look at the content that's been created and see what you can implement as part of your day-to-day to help educate people around this, as well as your care team. I can't emphasize that enough. I think because when I went out, I did look at what was being provided and kept thinking, there's really good content that we can use, and we don't have the time and resources to create new things. Plus, we were given, a link where you can order some of the content and it's free, which often doesn't happen for us. Liz, I think we covered all the questions that were in the chat or submitted. Can you just double check I didn't forget any?
Yeah, and I thought I'd jump in also. There were a couple questions submitted before, and actually to the last question, I wanted to mention too, we do encourage any patients, to at every health encounter to let their healthcare team know that they were pregnant, are pregnant, what complications they may have had during their birth. And I know some systems have even created little bracelets that they give at postpartum discharge that says, I had a baby on this date, or I was, delivered on this date. And it helps them every time they go to a health encounter that they have it. And it reminds the staff, oh, you're postpartum this many weeks, and maybe to spark that dialogue around, oh, and I also had high blood pressure, so that it can be remembered over time. A couple people had asked, or someone had asked, why are there disparities? Why are the differences? And I just wanted to acknowledge that, there's many factors at multiple levels that contribute to the racial disparities in pregnancy-related death, and in fact, infant mortality as well. But, we all know that social drivers of health have prevented a lot of people from racial minority groups from having fair opportunities for economic, physical, and emotional health. So we know there's structural racism, implicit bias that impacts the way people can receive care. We know there's a lot of variation in quality care by hospitals. And, also chronic conditions like cardiovascular disease and diabetes can lead to complications. So again, it's a very complex issue, and just wanted to acknowledge that.
So I think we've covered all the questions. If there's anything that we haven't, we'll just follow up and, provide, contact to the questions that were not answered earlier. I want to thank all our speakers.
Thank you. And Wanda, actually, we do have one additional polling question, and I was going to have a little bit of closing remarks, but to end the session today, we wanted to ask, and be honest, how comfortable do you feel, right now incorporating Hear Her into your practice? Either you are ready right now to start jumping in and using the materials, perhaps you're interested but kind of worried about some of the barriers there may be to implementing. You're interested but need more questions answered, which we are here at Hear Her at cdc.gov to answer those, or you're just not comfortable at this time. So we'd love for you to take a few minutes to let us know how you feel incorporating these materials. All right, we're getting some good participation. Thanks for not leaving us yet. Okay, I think we have a good amount of participation here. We can in the poll. So it looks like 63% of you guys are ready to start using the materials. That's fantastic. I know there's definitely barriers out there, and we would love to really hear from you about some of the worries to implementing, how we as a campaign team can make it even easier. Again, like Wanda said, we don't want to reinvent the wheel. No one does. So we want to make it as easy as possible for you to take the materials, use them where appropriate. And if there are items that you think are missing that would really be helpful, we would love to hear that as well. So please feel free to reach out. Let's go to the next slide. I did want to just close with just a quick story, actually, that Strong Beginnings had shared with us that remind us why we do this. But a woman had shared with them that during her first pregnancy, she was not listened to much. She wasn't sure what to look for and what the warning signs were. Her preeclampsia was not caught or noticed despite extreme swelling and headaches. The providers didn't let me make many choices, which brought up previous trauma triggers and made the birth process much more difficult. She says with her second pregnancy, she had a lot more knowledge and information. I had seen the Hear Her materials and was much more aware of the warning signs. And so we caught the preeclampsia much earlier. I was able to get the treatment I needed and was much more involved in the decisions with my care. I was able to advocate for myself better and describe my symptoms in a way that got healthcare professionals to listen to me. So it's just a reminder, of the great work you all are doing and why we are trying to make a difference here in improving maternal health. So thank you all so much for your time. On the next slide is just a little bit of contact information. If you would like to connect with Hear Her through our Facebook page or our division account through X, which was formerly Twitter. And as I mentioned, you can always email us at hearher@cdc.gov. We love to take questions. We love suggestions. We love to chat about how you might implement locally. So we are here, and happy to take a couple other questions, or Wanda, we can close the event.
I'll give it a second to see if there's any more. I think we've pretty much got everything. Great presentation and positive feedback. Just know that this will be made available. And I think part of the strategy is taking sections of this and making micro learnings. For those who said that there might be concerns about implementation, part of it is helping to educate our leadership and our health centers about why this is important. So using sections of this to make your case, like I stated earlier, opportunities to kind of educate our board and staff and to say, listen, I'm not talking about inventing new stuff. I'm talking about how can we leverage what already exists to help our community. I want to thank everyone for joining us today. I promise we will be continuing to share our content. Keep in touch with us. We will have this out probably in a week or two, and encourage you to share, and please connect with us if you have additional questions. Thank you to our speakers. I'm so thankful we were able to do this today, and thank everyone for their participation. And behind the scenes, our logistics team at NAC to keep us on track and keep us going and moving this work forward. Thank you so much.